Okay, so pretty much the whole point of these success stories is just kind of to get an idea of how your experience was here, what your care was like, kind of your story of progression as well. So just tell me a little bit about maybe what your condition was, symptoms, etc., that you're having before you came here, and what made you come into the office.
Okay, just start now?
Yeah, go ahead.
Okay, well, I have a long history of back problems. Should I look at that, or does it look at you,
Yeah,
or does
you
it
can
matter?
look,
Or
yeah,
what?
I'll stand
I don't
behind
know.
there so it makes it
I-
a little easier.
I've had 4 surgeries on my spine in the past, and it started when I was in my early 20s with a low back spinal fusion. And then later in life, maybe 20 years later, a disc in my neck ruptured. And since then, I ended up having to have 3 total surgeries in my cervical area. And what had happened then is I've been fighting with nagging problems in the neck and the low back area since. So it had progressed and progressed and progressed, and I'd done what I could, just on my own. And I think it came up until the point where last October, things were so bad that I was out of my mind with pain. I couldn't sleep. My neck, I had severe headaches, and it was just really totally disrupting my life. And I ended up going to a spine specialist and had a myelogram and was close to needing surgery again. And I thought, there's no way I want to go through that again. So I came here. And so I started with physical therapy, and it was really slow in the beginning. But then after a couple of months, I started to notice tremendous difference. And I really, honestly, was not that optimistic that, I had my situation was so bad, and I knew that there was progressive damage in the areas above and below the fusions. And I'd pinched nerves and, severe pain down the back of my legs, and losing my right arm, and for the 4th time. And I just really, was really just really hoping somebody could help me, but wasn't that optimistic. But I was pleasantly surprised by about Thanksgiving to start noticing differences.
And what kind of differences did you notice?
Well, the first thing that started to happen, I was able to sleep during the night, which was major, because I wasn't able to sleep, and that makes a difference. If you're well rested, then you're a little stronger during the day. And I started. The second thing I noticed is with the wobble chair, my spine was so stiff because I'm fused in so many places, and then when you're in such pain, you're so guarded that. Little by little, I could be on the wobble chair and my spine was moving in a lot of different directions, and that felt really great, and it felt healing. So I started to be able to do more and more of the exercises, and actually started to feel peppy, and it's just suddenly things started to be a whole lot better. I was on a lot of pain medication too, a lot of pain medication, and was able to get off all the pain medication.
So great.
So I was having trouble standing for any length of time. I was having trouble sitting for any length of time, and for the most part now, there's just really a tremendous improvement. And like I said, I wasn't, holding out a lot of hope. I thought for sure I need another surgery.
Right.
And in retrospect, I look back on it, and I think that had I had this kind of care after the first fusion, then I may not have needed the subsequent fusions. Because I understand that when you have a low back fusion, years later, because you've disrupted the normal curve of your spine, that you're going to, many people need further surgery because they put so much pressure in the discs in their neck area. But I also noticed with the adjustments that it was difficult at first, and I was having a lot of difficulty with the adjustments, and they were painful. But then over time, and really it didn't take that long. I've been here less than 6 months.
Which is not that long. Yeah.
No, it isn't, and it's just
considering everything.
Right. So now it feels great. I look forward to having the adjustments. They make me feel so much better afterward, and I understand that I'm holding the adjustments from week to week now, so I'm able to move in a more positive direction and heal. So I feel overall that this has been a tremendous experience. Everybody's been very receptive, very positive, very encouraging. open to adding more exercises if I need it, listening to whatever concerns I have. Everybody's so pleasant all the time. Every minute I've been here, everyone's been just very, very. They seem happy to be here and happy to be helping, and just very, very pleasant. So I'm thrilled. I mean, I really am thrilled, and I think that I know I'll stay with this care going forward, because I really kind of think if I don't, then I probably would end up, needing another surgery. So I think I wish more people would consider this type of care as not only as preventative, but kind of correcting and changing the path that your spine is going on. So, I'm just thrilled, and so I'm just looking forward to, continued growth and health in this area. So.
Yeah, and so how do you think, in terms of change, how this has changed, how you'll treat your health for the rest of your life? Do you think it's changed that?
I've always been good about caring for my health in so many ways, but the one thing I wasn't doing was caring for my spine, which I think I was a little afraid, because I was a person who'd had so many back surgeries.
Right.
So I was fearful of having chiropractic care. But now that I've been through it, I wish I'd done it 20 years earlier, because I think it would have made a difference. So there wasn't anything for me to be afraid of, because there are various ways of doing the adjustments. It's not just the manual adjustment, but the Pro Adjuster is just as effective, I think, and doesn't cause me any pain, or it isn't jarring in any way. And even with 4 surgeries on my spine, I still feel that it's not going to hurt me, and it is in fact helping. So that's the piece that I think that I would be adding back in. I've always ate right and took my supplements and exercised and everything else, but I think I needed that additional piece.
Yeah, great. Let's see if there's anything else that we wanted to go over. Anything else that you wanted to add, or what you would tell anybody else about peak performance or anything like that?
Well, I think peak performance is pretty unique in terms of what you would think a chiropractic office would be. I think that a lot of what is done here, the methods done here, seem fairly advanced, and there are multiple modalities that are offered here. It's not just chiropractic care. There's discussion of nutrition, there are seminars, there are, the whole physical therapy department, it's a department, is separate from the chiropractic, and the people who work there are so very, very qualified. And I just think that, this office is fairly progressive in that regard.
That's great. Well, thank you so much.
Well, you're welcome.
It's been so awesome just to hear your story and everything that you went through. So
yeah.
Thank you.